STIs, or sexually transmitted infections. They are contracted primarily through sexual contact. This contact includes vaginal intercourse, oral genital contact, and anal genital contact. STIs are caused by a bacteria or a virus. STIs caused by a bacteria include gonorrhea, syphilis, and chlamydia. STIs caused by viruses include genital herpes, genital warts, and HIV or AIDS. Let's start with the viruses. HIV and AIDS. HIV, or human immunodeficiency virus, causes AIDS, or acquired immunodeficiency syndrome. The two are linked. HIV destroys the body's immune system, which makes the individual susceptible to illnesses that a normal immune system could fight off. Without an immune system, common illnesses can become deadly. You cannot get AIDS or HIV from toilet seats, eating utensils, or even kissing someone with HIV. You can, however, get it from sexual contact, sharing needles, or blood transfusions with infected blood. Genital herpes. 3 to 5 days after contact, the individual will experience itching or tingling, followed by painful sores and blisters. It is important to note that genital herpes can be spread through non-latex condoms. There is no known cure for herpes, but there are drugs, like acyclovir, that can help with the symptoms. Genital warts. Genital warts is caused by the human papillomavirus, or HPV. Symptoms of genital warts are small, painless bumps in the genital area. HPV, or genital warts, is the most common STI in the 15 to 24-year-old age range. It can be treated with topical drugs, freezing, or surgery, but these methods are not 100% effective and the infection may return. There is a vaccine for females available. Now on to the bacterial STIs. Gonorrhea. Gonorrhea is caused by this bacteria, and I'm not even going to try and pronounce it. This bacteria thrives in moist mucous membranes, like the ones in the mouth, vagina, cervix, and anal tract. This is oral gonorrhea. Males are more likely to show symptoms in the form of penile discharge and burning during urination. Females, if they show any symptoms at all, will also have an irritating discharge. Gonorrhea can cause prostate, bladder, and kidney problems in men, as well as sterility. For women, it can cause infertility and pelvic inflammation disease. So it is important to get diagnosed and treated early. Gonorrhea is most successfully treated early with antibiotics. Syphilis. Syphilis is caused by this bacteria. And once again, I'm not going to try and pronounce it. This bacteria needs a moist environment and is spread sexually. However, it can also be passed to a fetus after the 4-month mark. Syphilis has 4 stages. Primary, where sores develop. Secondary, where a rash develops. Latent. In this stage, no symptoms occur. You may think you are free and happy, but in fact, you are not. And the final stage is called the tertiary stage. Here, cardiovascular disease, blindness, paralysis, skin ulcers, mental problems, liver damage, and death can occur. Syphilis can be treated effectively in the early stages with antibiotics. Chlamydia. Chlamydia is caused by this bacteria. Again, males are more likely to show symptoms with this STI, with penile discharge and burning while urinating. If a female does show symptoms, it's in the form of disrupted menstrual periods, nausea, vomiting, and headache. Chlamydia can cause infertility in females if not treated. Chlamydia is highly infectious, and 10% of all college or university students have chlamydia. So overall lessons here: use a condom, know who you are having sexual relations with, and get checked.